As medical providers, PAs and NPs have certain credentials that they have to get, that they have to maintain in order to be able to continue to practice. But then there are other credentials that we can get that add credibility to who we are as a provider and show people what our specific area of interest is. If you're a provider who has a special interest in diabetes and you want to be able to take better care of your patients, you want to demonstrate to your colleagues and employers that you have additional knowledge in the area of diabetes, then you may want to consider getting a CDCES certification. If you don't know what a CDCES certification is, then you're going to want to stay tuned because I'm going to talk to two different people. One of the people I'm going to speak to today is from the Certification Board for Diabetes Care and Education, who administers the CDCES certification. And another one is a PA who has the certification. He's going to talk to us about his motivation to get the certification and how he thinks it can help PAs and NPs in their medical practices. Hi, it's Michelle with the Medicine Couch. Thank you so much for joining me today. If you know of other providers that could use the information that I'm putting out, then please share my videos with them. Now let's learn about this certification and see if it's something that you want to add to your credentials.
My name is Sheryl Traficano, and I'm the CEO of the Certification Board for Diabetes Care and Education. We are a not-for-profit organization, and we actually oversee the certification program called Certified Diabetes Care and Education Specialist.
So for this CDCES certification, who all can become certified?
We are unusual because we're a healthcare certification, but we are actually multidisciplinary. We have registered nurses, we have NPs, we have PAs, pharmacists, we have social workers, physicians. So we have a huge gamut of health professions because of the way that diabetes can impact someone's life.
Sure, yeah, that makes sense. So what is the process to get certified?
Our qualifications for certification include, getting that original license or certification.
For whatever your profession is.
Right, exactly.
Right,
So
okay.
you get that that designation first, then you start working in the field. And so for us, you need then 2 years of general experience. So that does not have to be diabetes, but just general experience in their profession. And then we ask people to be able to document that they've had at least 1,000 hours doing diabetes care and education with people with diabetes. And people actually have up to 5 years to get those 1,000 hours because not everybody, it's not full time for everybody. And we just ask that people have about 200 of those hours in the last 12 months if they need to spread things out. They want to make sure that they have some current experience. And then the other aspect of the eligibility requirements is 15 hours of continuing education applicable to diabetes anytime in the 2 years before they apply. So once they can document all of those things, then they can apply to sit for an examination. And then once they pass that examination, then they're able to hold that CDCES credential.
You said that not everyone works full time. It popped in my mind. I guess that would be the same too if somebody who's working in family practice, not every patient that they're going to see is a diabetic.
Right.
Exactly.
Exactly.
So they can just log the hours of the patients that they worked with to get to meet their qualifications.
Right. Exactly right.
Tell us a little bit about the exam.
Sure. Yeah. So the exam is 200 questions right now. We're actually working on a new practice analysis. We may have some change to that, but people have 4 hours to take that. The cost to apply for the examination is $350. And that includes, that's everything. That's the application and taking the test. People can test both in test centers, and there's over 300 across the country. We also have live remote proctoring as an option. And then once people are certified, then that is good for 5 years. So then if they want to renew that, they have a number of different ways. But as long as they're still practicing in diabetes, then they can do it either by documenting continuing education or they can take the examination.
What are the reasons you hear people say that they are going for this or have gotten it?
I think the biggest thing is really to have their knowledge of diabetes sort of verified that. So I think for the most part, it really just helps demonstrate basically to people with diabetes and even other members of the healthcare team that they do know what they're talking about. It also gives people more confidence, I think, once they have that credential. If you aren't already certified, but you are dealing with people with diabetes every day, which almost all of your folks are, then, kind of like why not be recognized for having that knowledge? But the other thing is, if certification just isn't in your future, make sure that you're referring your people with diabetes to, a certified diabetes care and education specialist, or definitely an accredited or recognized diabetes education program, because it can make such a huge difference in their lives with how they're coping with and living with diabetes.
So we just heard from Sheryl Traficano from the Certification Board for Diabetes Care and Education. But now we're going to talk to a provider who actually has gotten that certification and uses it in his practice. And he's going to tell us a little bit more. So welcome, Brian. Thanks for joining us today.
Yeah, thanks for having me. Hello, everybody. I'm Brian Burroughs. I'm a physician assistant. I graduated in 2019 and I have a CDCES credential.
So it seems like that this certification is really kind of a great way to set a goal to learn more about diabetes just as a
Mhm.
whole so that you can talk in a more well-rounded way with your
Yeah.
patients and have a little bit more of a comfort level with nutrition and the other things that we don't really get a whole lot of training in school.
What I learned in PA school and what most providers do is they treat a patient's diabetes. They treat the disease. Whereas the approach of the diabetes care model that the CDCS follows is more so treating the patient who has diabetes, a more holistic approach, team-based approach, and I think it results in better care and better outcomes for patients.
How do you feel like that has helped you in your practice, or do you think it's helped at all having this certification?
The knowledge that I've gained and the perspective that I've learned has really helped me to provide better patient care. And that's not always just me providing the patient care, but having a better understanding of that collaborative model and knowing, oh, I should have you speak with our pharmacist, or you should speak with the diabetes educator or the dietitian. So I think it's really helped improve my practice and the care that my patients are getting. It's also been a boost for me professionally as well. I can't say it's directly from obtaining the credential, but I have been involved with different committees based on diabetes care and clinical practice and been in leadership positions in those committees. I think having that credential added a little bit of boost to my credibility and just people understanding my interest and passion for diabetes.
Did your organization cover that, or is this kind of out of your pocket?
I was able to use my continuing education funds to pay for the credentialing.
Do you see any way that this could potentially help any providers bring in more money or help them financially in any way?
I did not receive any additional compensation for doing it, but it helps for things when like looking for academic rank or other things like that. As far as actual compensation, I could see it happening in other situations that aren't mine. It might be that it makes you a better candidate for a higher paying job within like a specialty practice or a specialty position within a larger institution.
Well, another thing that I was just thinking is that I'm always looking for opportunities for people to develop like a niche practice within a practice. And this is one of those things that I could see if you are working in a family practice and you really enjoy diabetes management and working with patients who have diabetes, this could really help you kind of tailor your practice to be like the diabetes person in the office. Have you noticed that at all in your practice? Like, do you tend to do more diabetes? Do people send patients your way at all?
I am a big proponent of having that niche practice, and it's one of the things that I love about family medicine. And yeah, I've started to have a little of that. I rarely find myself sending people to endocrinology. I enjoy and am comfortable managing more of those complex diabetes patients. And then we were recently had a period where we didn't have the same endocrinology coverage we usually did, and I was able to kind of help fill in that gap. So just answer questions from my colleagues, or colleagues would send me their patients to have a visit to try and help sort out some of their medications or different things like that. So I think it would be a huge boost if that's something that you're shooting to do.
Along those lines, are there other certifications in diabetes management that PAs and NPs could potentially consider?
Yep. So there is another certification called, so it's board certified in advanced diabetes management. That one is through the Association of Diabetes Care and Education Specialists. So a different group. It requires an advanced degree, so it need to have a master's degree. And then it focuses a lot more on management and the individual patient and their management, and less so necessarily on that holistic approach. I don't want to speak out of turn for those groups, but that's my general conception of how they're different. I also have that credential. It shows a higher level of skill mastery of the material, which is nice to have, but in contrast, that CDCES is really key to being that team member, that holistic component, and really understanding the model. So they go really well together. And if you study for one, there's going to be a lot of overlap in studying for the other. So it's something certainly worth pursuing as well, or at least considering.
Okay, well, any final thoughts on why you think PAs and NPs should consider this, or what it's meant to you to get this certification?
It gives me objective, concrete proof that I accomplished something, that I mastered the material. Because oftentimes I'll be like, hey, I really want to learn more about COPD or asthma, something like that. And then you do a lit review, you do some CMEs and things like that, but you're like, oh, how well did I really retain this? How much do I really know? Where this proves to me, myself, as well as my colleagues, that I really did do that work and have that understanding now. So that's one of the big things I like about it as well.
Now, talking about certifications, if you are a PA who is coming up for certification, then you are going to have to choose between the traditional PANRE and the new PANRE LA online version of our recertification exam. If you want to know more about this new format and compare and contrast it against the traditional PANRE, then you're going to want to watch this video here. I also have some more videos in that series. They give you information on resources to use for the test, some good tips on how to take the test, and answers some more questions people might have. As always, thank you so much for watching, and I'll see you next time on the Medicine Couch. Bye.